Which of the following terms is used for an individual who is or has delivered or is about to deliver their first child? A. Nulliparous. B. Primiparous. C. Gran multiparous. D. Multiparous. The answer is B. Primiparous. Nulliparous, never delivered a child or carried a pregnancy past 20 weeks. Primiparous, has given birth once or is about to give birth for the first time. Multiparous, has given birth twice. Gran multiparous, has given birth 3 or more times. Which of the following hormones stimulates uterine contractions? A. Estrogen. B. Oxytocin. C. Progesterone. D. Prolactin. The answer is B. Oxytocin. Contractions in labor are stimulated by oxytocin, a non-peptide hormone produced in the hypothalamus and stored in the posterior pituitary. Oxytocin also triggers postpartum contractions in order to compress the lax uterine wall and reduce postpartum bleeding. Prolactin is a hormone essential to breast milk production, while estrogen and progesterone have a multitude of roles in both fetal and placental development. Which of the following is not a role of oxytocin? A. It triggers uterine contractions during labor. B. It stimulates contentment and pleasure in social relationships. C. It is involved in wound healing. D. Increases appetite. The answer is D. Increases appetite. Oxytocin, a non-peptide hormone produced in the hypothalamus, has a variety of physiological roles. It increases trust, generosity, and other markers of social cohesion. In intimate relationships, it increases feelings of affection, love, sexual arousal, and contentment. It is an important hormone in labor, as it triggers contractions both during labor and postpartum in order to reduce bleeding and uterine size after delivery. It also acts as an immune modulator in wound healing. It does not, however, increase appetite. Studies have shown it to have the opposite effect, acting as an appetite suppressant in human and animal models. Which of the following terms describes the thinning and shortening of the cervix that occurs during labor? A. Transition. B. Bloody show. C. Dilation. D. Effacement. The answer is D. Effacement. During the later stages of labor, the cervix, normally a 4 cm long muscular sphincter, releases its mucus plug, then thins and shortens. The release of the mucus plug is termed the bloody show, and the thinning and shortening of the cervix is called effacement. Cervical effacement is almost always accompanied by cervical dilation, or a widening of the os in order to allow passage of the fetus. This all happens in the transition phase of labor. At what point during labor is the cervix considered to be fully dilated? A. 11 cm. B. 8 cm. C. 9 cm. D. 10 cm. The answer is D. 10 centimeters. The cervix is considered to be fully dilated at 10 centimeters. This suggests the transition phase of active labor, in which the individual is instructed to bear down, push, in order to facilitate delivery. How does blood plasma volume change over the course of a normal pregnancy? A. Increases by 50%. B. Increases by 25%. C. Decreases by 10%. D. Decreases by 25%. The answer is A. Increases by 50%. During a normal pregnancy, the volume of blood plasma increases by 50%. The erythrocyte count also increases, by as much as 30%. This may cause the hematocrit to appear lower than normal, due to dilution by the relatively larger increase in plasma. What hormone is responsible for triggering nausea and vomiting of pregnancy, morning sickness? A. Dihydroepiandrosterone, DHEA. B. Corticotropin-releasing hormone, CRH. C. Aldosterone. D. Human chorionic gonadotropin, HCG. The answer is D. Human chorionic gonadotropin, HCG. While research is still being conducted to determine the cause of nausea and vomiting of pregnancy, it generally correlates with the surge in human chorionic gonadotropin, HCG, that occurs in the first trimester. Estrogen may be another contributing hormone. Aldosterone, DHEA, and corticotropin-releasing hormone, CRH, have no apparent involvement. Most at-home or in-office pregnancy tests detect what hormone? A. Estrogen. B. Progesterone. C. Prolactin. D. Human chorionic gonadotropin, HCG. The answer is D. Human chorionic gonadotropin, HCG. Most pregnancy tests detect HCG, a hormone produced by the embryo that is detectable shortly after implantation, 10 to 14 days after fertilization. The function of hormone is to mimic the effects of luteinizing hormone, ultimately preserving the corpus luteum, which secretes progesterone. The progesterone maintains and vascularizes the uterus, making it a more favorable environment for the implanted embryo. A nurse is educating a group of young females about the physiology of fetal development. The nurse explains the stages of how a young fetus over time will develop and what special events take place over time. Which of the following events is correctly paired in regards to expected fetal development? A. 8 weeks, sex of the child is recognizable. B. 10 weeks, lanigo grows. C. 12 weeks, quickening occurs. D. 15 weeks, the eyes are open. E. 20 weeks, heartbeat first heard with a stethoscope. The answer is E. 20 weeks, heartbeat first heard with a stethoscope. The time frame correctly matched is at 20 weeks. The heartbeat is heard with a stethoscope, although it may be heard with ultrasound as early as 10 to 12 weeks. Quickening usually occurs around 20 weeks as well. The eyes open later between 24 to 27 weeks, lanigo first appears between 13 to 16 weeks, and the sex is recognizable around 12 weeks. At what embryonic age does the neural tube form? A. 5th week. B. 6th week. C. 3rd week. D. 4th week. The answer is D. 4th week. The neural tube forms from the neural plate during the 4th week of embryonic development, which is often before the mother knows of the pregnancy.